We're back on Carolina Women. I think it's time for us to visit Bluffton Aesthetics. They always have something interesting to share with us about how we can improve our overall health and wellness. Stay with us. We are here at Bluffton Aesthetics for our field trip today, which we love. Charlotte has joined us. You are a regular now, and we look forward to talking with you. Wait, I'm excited about today. We're lip flipping.
We're lip flipping.
All right, let's talk about that because I hear really amazing things about that.
Yeah, absolutely. So we're going to talk about what a lip flip is and why somebody may want to have one done. So a lip flip is just a fun term for putting some type of neuromodulator injection right above your upper lip.
Okay.
So Botox, Xeomin, Dysport, anything of that nature.
I love how when she's talking to me, her eyes are like right here. Right? I'm like, hey. But when people come in for a consultation, is that what you're trying to decide? What procedure is most efficient or accurate or the best for that person?
Absolutely, and I never want to go apart and picking things out for a patient, but typically what I notice on them is what they notice on themselves. So basically what we do when we do the injection is we help to soften smoker's lines, and it also helps to make your upper lip appear bigger. And it's all just because we're helping to soften the muscle that surrounds your mouth.
So how would that work as far as doing it?
It's really a 2-second procedure. We just do 4 little pokes right above the upper lip. It's really easy.
And then downtime or anything?
No downtime. So it does take a little bit to kick in.
Okay.
And once it kicks in after about 2 weeks, you can go about your normal schedule. The day after, you can go about your normal schedule. So there's no downtime.
Is it actually a Botox that you're using for that?
Yeah, Botox.
So what is
Xeomin.
it doing there? Because is it doing something different here than here?
So the mechanism of action is the same. We are injecting it into the muscle, and it's paralyzing or partially paralyzing the muscle you're injecting into.
Okay.
So that mechanism is the same, just the way it appears is a little different. So we're not necessarily helping the muscle contraction the way you are in your forehead, but it just helps to soften the muscle so that it helps those smoker's lines and helps your upper lip to appear a little bit bigger.
So as we age, okay, what happens? I've never smoked in my life, and I still have those little lines. Is that just collagen?
Yep, it's exactly. A huge part of it is just collagen depletion and genetics, and also the muscle that surrounds your mouth is, every time you blow a kiss or suck through a straw, you're using that muscle and forming those wrinkles. So that combined with collagen loss is what really gives you prominent smoker's lines.
So what else? You said you would do that, the lip flip.
The lip flip.
What are other options?
Sure. So a lot of people think that a lip flip is the same thing as lip filler, and it is not. So with the lip flip, you're not adding anything into the actual body of the lip. With lip filler, you're actually putting filler inside of the lip.
Got it. So that's, all right, so where is that? Where do you do that?
Right where you notice the pink part of your lip is where lip filler goes.
And so does that literally add volume?
It does, exactly. So the main component of the fillers we use in the lips is hyaluronic acid. And so it plumps up the lips. And actually I love to use the lip flip in combination with lip filler.
Okay.
I find it gives a very natural result.
I think that's really what I'm most interested in. I have seen people who have had fillers in their lips that it just almost shifts their look.
Right.
And so that's, I know you, and that's like, no, that's not the goal.
Exactly. It can be done very poorly, but I'm all about natural results. And a lot of patients are worried about getting filler because they are worried that they won't look like themselves. All I'm doing is making your lips look like they looked 20 years ago.
So what happens? Does it just, because of the collagen, everything just sort of
it just feels
smaller?
Exactly. And anatomically, the area in between your nose and your lip, it widens and gets longer, so that causes your lip to look smaller. Collagen depletion causes wrinkles inside your lip, which makes them look smaller. Everything kind of folds inwards.
I know we've only got about 30 seconds, but I'm really curious about this. Can you come up with a master plan for me, for your client, your patient?
Absolutely, that's what I'm here for. We offer a free consultation, so if you're kind of on the border about if you want a lip flip or lip filler and you're not sure where to start, come on in, just chat with me and we can figure out a plan that will work best for you.
Talk about user-friendly. She makes it so easy. Well, you make it feel natural,
too.
It's not any big, it's just like, okay, here's what we're gonna do and here's how we're gonna do it. As always, Charlotte, it is great to see you.
Absolutely, thanks for having me.
Yes, thank you from Carolina Women. Stay with us.